Hi, I'm Dr. Aunna Herbst from Salt Health in Bentonville, Arkansas, where we provide a concierge blended medicine approach, which is primary care family practice board certification for myself and for the physician's assistant, as well as functional medicine. It's a top of the line wellness approach with a team, including a registered dietitian, some registered nurses. We have a phlebotomist on staff. We also have a trained physical trainer, as well as the rest of the health team. And it is growing. We even have a health coach now on staff as well for patient care and coordination. So today I'd like to talk to you a little bit about NAD. This is a nutrient that is not new to me, but the use of NAD via IV is actually fairly new to me in practice. I've been researching it for years and been eager to try it. However, I've had a hard time getting a hold of it because the research was so promising in the last few years that it seemed to be very difficult to get a pharmacy that had it in stock for a while. So anyway, nicotinamide adenine dinucleotide is a very important molecule or cofactor necessary for everything, including mitochondrial function. Every single cell is very dependent on it. Everything from energy production to circadian rhythm to aging, which includes DNA repair and expression. NAD is part of the electron transport chain, which is part of the Krebs cycle. And for those of you that have not studied it, then that is part of how our body makes energy, ATP. So every cellular function is dependent on NAD and its derivatives, NADH. It is important in the literature now. It has a really big interest as far as literature and publication in the area of cognitive decline, because they're noticing that it can be helpful if person is given NAD via IV, oral, or topical, or by injection in slowing the cognitive decline process. This most likely is due to the fact that it helps maintain cellular repair as well as mitochondrial energy production. Why would we give it and why do we use it at Salt Health? Well, we can use it for a lot of things. I've used it for some of my chronic fatigue patients to help them with energy production, especially when I noticed when they did a nutrient test and they were low in niacin. I also would do it if someone has a nutrient deficiency picture for mitochondrial, impairment. I also would use it for someone that may have some refractory depression, as there's a lot of good literature for that as well. I have studied in the literature a very large amount of use and some good outcome data for drug and alcohol and food addictions. I have used it for binge eating, for people that were trying to get off of the use of heavy alcohol consumption, as well as I have patients that have used it to help them come off of addictive medications. With the help of their psychiatrist, they've all been very successful thus far. I also have seen in the literature quite a bit of information relative to the anti-aging studies, and that can help with some improvement of skin integrity as well as decreasing aging spots. Dermatology is using it quite a bit in topical applications now as well. There's a lot of interest right now with cognitive decline like dementia and Alzheimer's, and the use of NAD and how it is showing in animal models, particularly reducing the amount of plaques and tangles in the brain, as well as improving cellular repair. And also there is a good amount of literature in the positive light for use of NAD for post-stroke myelin and myelination repair, so helping the neurons recover and repair after a stroke. I also found some literature involving about, I think it was 73 women. It was a small study with fibromyalgia using NADH, the supplement NADH, which is the precursor for NAD+. And they showed significant reductions in fatigue, as well as some positive changes in mitochondrial function, improvement in detoxification, and so forth. One of the things that they've noticed is that restoring NAD by supplementing NAD plus and its intermediates can help slow the aging associated functions that they've noticed in animal models. And that includes everything from just skin integrity to the neurodegeneration, as I mentioned before, like in dementia or Alzheimer's. We do know that with age, our levels of NAD decline. And we also know that with age, sirtuins, which are called the guardian genes, so they protect us from DNA damage and cell deterioration, those are very dependent on NAD. So this is why the literature, starting back in the 60s, it was, I'm sorry, in early 1900s, it was discovered, and then starting in the 60s, it was really investigated and started to be used in the oral forms, in the precursor forms. They were using it to help slow the aging process, at least to research the aging process. There are several precursors that help us use or make NAD+. But we do know that as, like that little slide there shows, that NAD declines with age. And as a result, then of course, our cell regulation also declines and the aging process speeds up. So it logically makes sense to pursue this, if you are a researcher, to pursue this as an anti-aging molecule, or at least to learn how it is involved in that process. It can be given in several different ways. It can be given orally, as I mentioned, although NAD plus typically in the past was not really well tolerated, nor did it show to be very efficient when taken orally because of the digestive process. It has a positive charge that ends up being converted pretty quickly, oxidized and changed in the redox pathways. But what they have found now is they can put it in a sublingual form, and they have pretty decent reports of absorption and elevated serum levels of NAD and NAD precursors. So that's really positive, especially for people that cannot afford an IV therapy or don't like needles. They can also have it, of course, delivered IV. This is probably the most researched and the most utilized, especially when it comes to depression and addiction in the literature, and it is delivered via IV slowly. Some people can give it a little bit fast, but they have to also give the patient a little bit of anti-nausea medicine because it can cause some nausea and some kind of weird euphoric feelings if delivered too fast. So we deliver it really slowly, and over about 3 to 4 hours is the minimum in our office. They also have some new information on topical NAD plus patches. I'm not familiar with the use of these. I just learned about them recently, and I'm still in the midst of investigating this delivery method as well. We have started using sub-Q and IM injections in the office for convenience. You can give a much lower dose subcutaneously, and the patient can take it over a period of time, taking a break on the weekends, like 5 days on, 2 days off, 5 days on, 2 days off for a few weeks. And then I feel like with the complements of the other things that we're doing, including diet, exercise, rest, sauna, nutrient replacement, the patient then could just do sublingual NAD therapy if they need it, or just continue with the healthy lifestyle that they've now implemented thanks to our team. Let's see what else I'm going to tell you. Oops. One of the positives of doing oral would be that it's cheaper, it's convenient, but it has some negatives in my opinion because it is very dependent on transporters and receptors. It's also very dependent on absorption and digestion. And unfortunately, a lot of people that are ill or that are looking into the use of IV NAD or NAD therapy in general have a lot of GI upset, or they have some transporter issues from a genomic standpoint, or they've been, let's say, taking a medication or drinking an excessive amount of alcohol, thus wanting to help get off of it and detox and have a smoother transition away from those substances. And therefore, because of that long-standing history of medication or alcohol consumption, they might have even poor mucosal integrity and therefore malabsorption sort of picture. So oral for them probably would not be optimal at the beginning of their journey, but maybe it might be an option for them later. IV is an immediate, right into the bloodstream, 100% delivery. As far as oral, the literature that I'm finding shows about a 40% uptake and increase in the NAD and in NADH in the body when taking oral versions of NAD+. Whereas if you put it into the bloodstream, it's 100% delivery. So there's a positive that as well. I have had the pleasure of learning more and more about genomics, which these are small changes in the DNA structure that change the body's ability to metabolize or process things, whether it's an enzymatic process or an actual direct change in, say, nutrient metabolism. Either way, it's just not working as ideal as it should be. And some of these genomic SNPs or mutations can be altered or improved, suggested by the literature with the use of NAD+. Some of them include TMEM, which has to do with like white matter lesions in the brain, which is could be related to or a cause of some person's neurodegenerative disorders like dementia or frontal Pick's disease and things like that. So that's an area that we are looking at the literature for the use of IV NAD. There's some literature that suggests the SLC4A7, which is related to the addiction pathway, can benefit from NAD+. There's also interesting literature on the NQO1, which I don't have listed here, but it has to do with the conversion of CoQ10 to ubiquinol, which is made in the liver. It's used for the electron transport chain. It's very important for protecting muscles from breakdown. So anyway, it also can be, NAD can also be beneficial to the NQO1 mutation patients. So anyway, there's several genetic variabilities or variants that could benefit from, could support the patient benefiting from NAD+ replacement. We have just started using it in the office, so we're very new to NAD in our practice, but I would say average success rate for the use of IV NAD as well as injectable form of NAD is very high. It's greater than 90% success rate, and it's dependent on what the patient was using it, for what the patient was using the NAD. So for instance, some people had improvement in energy. I've had a couple of people that said that they've had compliments about their skin improving. I know with myself, it helped me with sugar cravings. I tend to have low energy at night. You know, I feel like I crave sugar, and I assume it's because I'm pretty tired and I want fast energy. And I noticed that when I was using the injectable form, just trying it out on myself, I didn't have that. I also do have the genomic variant, the SNP, in the where I have trouble converting CoQ10 to ubiquinol. And I noticed that it helped with my energy from a workout standpoint. So I was able to work out a little bit harder. I was able to really not be exhausted when I was working out. It just gave me a lot more energy when it came to exercise. Also, it has been very helpful for some of our patients with the decreasing the need for addictive medications and getting off of medications that were very addictive, like your some of your stimulant medications that we use, say, for like ADHD and so forth. Also, we've used it for some withdrawal states and helping them with that transition away from, toxic substances like alcohol and so forth. So anyway, so far, we've had really good feedback, and these are just some simple testimonials that I think speak for themselves. So that's a little bit about NAD. Sorry for all the ums and ahs. I have a lot in my mind about it. I'm still learning about it, but I'm finding it a fascinating field, and I'm finding it an amazing nutrient to use for my patients. Have a great day.